35-year-old man presents with loose stools and left lower quadrant abdominal pain. He says he's having 8 to 10 loose stools per day. The volume of each bowel movement is small and appears mucoid with occasional blood. The patient reports a 20-pack-year smoking history. He also says he recently traveled abroad to Egypt 3 weeks ago. His vital signs are a blood pressure of 120/76 millimeter mercury, a pulse of 74 per minute, and a temperature of 36.5 degrees Celsius. On physical examination, there is mild to moderate tenderness to palpation in the left lower quadrant with no rebound or guarding. Rectal examination shows the presence of perianal skin ulcers. Which of the following is the most likely diagnosis in this patient? So, in this particular case, patient is presenting with loose stools, left lower quadrant abdominal pain. Stools is mucoid with a little bit of blood. So if you look at the options given over here, pretty much all of them can kind of fit this description. But for those of you that answered right, which firstly is amazing, clearly saw the keyword in this question, which was the travel history to Egypt. So anytime in any particular case scenario, you come across them mentioning a travel to an endemic area or area where you know there's a certain disease that's involved. For example, if they're going to be mentioning the Middle East or even Egypt for that matter, I'm not saying with respect to this question, in general, think of schistosomiasis, because I've come across quite a few questions where they kind of expect you to know that. So there's just one disease that's kind of endemic to the Middle East, and amoebiasis is one other disease that's not just endemic to Egypt, but in developing countries in general. Okay, but otherwise, if you look at it, Crohn's disease, ulcerative colitis, both can present with, your diarrhea. They can present with, mucoid. They can have occasional blood. More common ulcerative colitis to be presenting with this. In addition, ulcerative colitis patients can also present with colicky abdominal pain or tenesmus, in addition to just the diarrhea. Salmonellosis, okay, due to food poisoning, it's acute gastroenteritis. Usually they will not have dysentery, they're just present with loose stools. And in addition to that, they'll have fever. In this case, the patient's temperature is completely normal. And anytime you see diverticulosis, okay, first thing I want you to look at is the age of the patient. Very, very unlikely that they're going to mention someone as young as 35 years if they expect you to arrive at diverticulosis as an answer. Usually it's going to be, the elderly people, usually above 50 years. So the question stem will usually involve someone who is 60 or 70 years old and will present with painless rectal bleeding, or they'll just maintain hematochezia. Okay, so none of that fits this description, because in this case it's only mucoid with occasional blood. So with that alone, you can rule diverticulosis out. And like I mentioned, the other ones are pretty similar to this, but you just kind of have to look for the keyword. And in this question, it's the travel history to Egypt. Okay. And moreover, since he's only traveled 3 weeks ago, in general, amoebiasis does usually happen only 2 to 4 weeks after the exposure. So sort of like a subacute disease. So with that also, you can kind of narrow it down to amoebiasis, because inflammatory bowel disease is there on like the longer run. It's a chronic inflammatory disease, not a subacute or acute presentation. So that's how you know it's amoebiasis.
Thanks for watching. Please give a thumbs up and subscribe for more.